Today, I really appreciate it. Just by a show of hands, how many people have been to a Medicare seminar? Okay, great. And how many people are turning 65 in the next year or two? Okay, let's jump right in. Hopefully, I'll teach a little something here. First, let me just introduce my family. So this is over Christmas. My 18-month-old son at the time was boycotting Santa. That's my 1-month-old daughter at the time, and my lovely husband, Joshua. Tom did a great job introducing me, so I'll skip right to the states that we're licensed with. So many states we're covering. We're here in Maryland, Virginia, and D.C. Some of the services Steinlage Agency provides, all of our services are free to clients. So we focus specifically on Medicare. We're not doing Social Security, just Medicare. We help you bridge the gap from retirement, whether that's early retirement, retiring at 65, or if you decide to work past 65, we help you transition from group coverage into Medicare when you're ready. We also handle Affordable Care Act, ACA, Obamacare plans. So if you retire early and you want to compare COBRA costs to what else is out there, we sit down and we look at your prescriptions, your doctors, and what those costs are. We are an independent agency, which means we are licensed with almost all major carriers across the nation. When we sit down with our clients, we are representing you, and we are showing you a true portfolio of what's available each and every year. We do annual reviews for all of our clients, typically in the October, November, December timeframe. If you go with a Medicare supplement, which we'll discuss a little bit more in detail, we can rate shop that anytime throughout the year. You'll have my cell phone, you have my email, and you know exactly where my office is. So anytime you want to reach me, again, it's all no charges. So today I want to touch base on 3 major things. Who is eligible for Medicare? What is Medicare? And how has recent regulatory changes affected Medicare? And how does this affect your enrollment? So who's eligible for Medicare? Typically, the general rule is anyone who turns 65 has to take Medicare. There are exceptions to the rule, which we'll touch base on here in a second. But anyone turning 65 has to take Medicare. Anyone who's under 65 and has disability for 2 or more years is automatically enrolled in Medicare. Anyone who is diagnosed with end-stage renal disease is automatically enrolled in Medicare. Anyone who delays Medicare at 65 because they fall into the exception of the rule, anyone who delays Medicare at 65 and then retires or comes off their group coverage is eligible for Medicare. So let's talk about that general rule and the exceptions. So general rule, you have to take Medicare at 65. The exception to that rule is unless your employer is a large employer and you have active coverage under that employer. So the size of your employer is determining whether or not you have to take Medicare at 65. So if you have plans to work after 65 and you are with a large employer, 20 or more employees, or your spouse is with a large employer and you have group coverage under that employer, then you have the option to delay picking up Medicare Part A and Part B. Okay? So 20 or more employees, you can opt in or out of Medicare at 65. If you're under 20 employees, then you have to take Medicare at 65, Part A and Part B. Otherwise, you'll get hit with a penalty and you'll be forced into the open enrollment period, which may give you gaps in coverage. Any questions on that? Chip?
So one would have to ask their employer, I would assume, if they have, is it like 20 employees that they cover under health insurance? Because a company may have 25 employees, but only 15 are on their health insurance.
It's the size of the employer, not necessarily the size of the group that's getting covered. So if it's part-time or full-time employment, 20 or more part-time or full-time employees. I'm not sure why the government chose 20, but anything over 20 is considered a large employer, and that means you can delay or have the option to delay. So that's where I sit down with a client and I look at what are your current benefits with the large group employer and how do those costs compare to the costs with Medicare, your supplement, your drug plan, your Advantage plan, whichever route you choose.
So some of our clients could be right in the middle. They could be at one part of the year, they could have 19 employees, then they turn around and they have 24 employees.
Correct.
At what point is it determined when I'm coming out and trying to decide if I've got to take Medicare?
I'll have to look into that for you, but typically if you're on the cusp of 19 and 20, I would advise getting Medicare just to avoid any sticky situations. Yeah. But I'll research that for you.
Okay, thank you.
So another caveat to watch out for is if you have a large employer, 20 or more employees, and that employer group coverage is an HSA, then you really want to watch out because if you sign up for any portion of Medicare, because it's a better deal or you just want to have secondary coverage, then you can no longer contribute towards your HSA once you're in Medicare. So if you sign up for the premium-free Part A as a secondary policy, because it's free, it's just going to hang out in the background, and you're working past 65 with an HSA, then you're in troubled waters because now you can't contribute towards your HSA because Medicare and IRS does not allow you to have more than one high deductible plan or more than one health care plan. So you can't have Medicare Part A and a high deductible plan and still contribute towards your HSA. All right, so what I always tell clients is if you have an HSA and you are kind of teetering between opting in or out of Medicare at 65, give me a call and we'll run through the numbers and just make sure you're in a good spot for the next few years. Another thing to note is if you do opt out of Medicare because you're on a large employer plan, and let's say you retire 6 months or 2 years after you opt out, you create a special enrollment period to get into Medicare Part A and Part B upon retirement or loss of that large group coverage. So if you and your wife or you and your husband are on the spousal coverage or your own coverage and you retire, you trigger a special enrollment period that allows you to get into Medicare A and B without any penalty or negative consequence. All right, so that's your new open enrollment period, or special enrollment period. Again, 20 or fewer employees, you have to get Medicare at 65.
Is there a period of time that you have to enroll? So let's say you get special enrollment, you do, but for whatever reason procrastinate and you don't enroll? I mean, I know obviously
8 months.
you don't have coverage, but you say 8 months?
8 months, yeah. So 8 months from the day you lose your group coverage, large group coverage, triggers kind of your time frame. You have 8 months from that loss of coverage to sign up for Medicare Part B, and then after 8 months, your special enrollment period closes.
And what about COBRA? So let's say I leave, and what about COBRA?
Yep, so if you're under 65, and let's say you're under 65, you have an early retirement, and you take COBRA for 18 months, and now you're floating into Medicare at the 12-mark period, you have to take Medicare. COBRA is not considered credible or active coverage, and it doesn't fall into this exception to the rule. You have to take Medicare at 65 if you're on COBRA.
So just to summarize, if you continue working till you're, say, 67, you don't have to take Medicare till you're off and your employer's covering you. You wouldn't have to be off your plan until
Your retirement. Correct. So long as that employer's 20 or more employees. So next question, what is Medicare? Let's say you're turning 65 or you're turning 67 and you're opting into Medicare now. What am I getting? So Medicare consists of two moving parts, Part A and Part B. Part A is hospital coverage and is generally a zero premium for the hospital Part A. If you work 10 years or more and you paid Medicare taxes, you're getting that Part A hospital coverage for free, zero premium. If you have fewer than 10 years, then that is a higher figure for you. Depends on how many quarters you have under your belt. Part B is medical coverage. So this is going to include doctor office visits, blood work, x-rays, outpatient surgery. Everything outside of the hospital, more or less, falls under the medical portion. Part B is a standard premium of $144.60. That changes each year. Last year it was roughly $135.50. This year it's $144.60. If you are considered a high earning individual, you're making over $87,000 a year, then your standard Part B premium of $144.60 is increasing. So it's income based. And we'll touch base on that. That's called IRMA, Income Related Monthly Adjustment Amount. And we'll touch base on that towards the end of the seminar. Because
If
it's,
you file a joint return, isn't it different than the 87?
yep, that's a single, so if you're over 87 is a single tax filer. If you're over 100 and, I believe, 84,000,
Okay.
174,000. We'll see the figures here in a second. So it depends on if you're a single or a joint filer.
Okay, but we're different ages, so which age do we use?
You and your spouse,
My spouse is younger than I am, so
you're using your joint, are you filing together or separate?
together.
Okay, so you're using your joint modified adjusted gross income, even though she's younger. Medicare's looking at your joint modified adjusted gross income.
Question? You said you have to have 10 years that you paid into Medicare?
40 quarters.
Okay, so what if one spouse has that and the other spouse doesn't?
You can file under your spouse's 40 quarters. Yep. Good question. So what is Medicare? You see the Part A, Part B. You have a premium for the Part B only. If you just have original Medicare, no supplemental or Medigap plan, no Medicare Advantage plan, no federal plan to come in, no TRICARE, then you have 2 deductibles that you're responsible for, and then once you meet the deductibles, Medicare will cover 80% of the bill. So your deductible for Part A is roughly $1,400, you'll see here. $1,400 per 60-day occurrence. So let's say January 1st you enroll in Medicare, and January 5th you go in for a heart issue, you go into the hospital, you're responsible for the first $1,400 of that hospital stay. And let's say 5 months later you go in for a knee issue, you're in the hospital for a week or 2, now your deductible has reset because you're outside that 60-day occurrence, and now you're paying another $1,400. So that's a very large gap that Medicare does not cover. Your Part B medical deductible, so if you go in to see the doctor or get blood work or get your x-rays, you're paying the first roughly $200 for the year. Once you meet that $200 deductible, then Medicare is going to cover 80%, and now your exposure is 20% for the rest of the year. There's no cap or ceiling on that 20%. So that's your largest exposure.
So outpatient would be considered hospital.
Part B, medical.
So anything outpatient.
Yep. So if you have a knee surgery, knee replacement, your outpatient medical, Part B, with just original Medicare, you have a 20% exposure. So that's your gaps in Medicare. And this is a very bird's eye view. We can get in the weeds, but in a nutshell, that is Medicare. Deductibles, once you meet them, Medicare's covering 80%. So all of the noise that you're going to get solicited with about 6 months out from your 65th birthday, all of those products are coming in to fill the gaps of Medicare.
The 20%.
20%, deductibles, etc. And that next slide we'll look into what are my options. What are these products? So again, we still have original Medicare Part A and Part B up top here. We have our deductibles, and then we have our 80%. That's primary Medicare, original Medicare, giving you 80% coverage. To fill that gap in Medicare, you can go 2 different options, 2 different routes. Route 1 is you keep original Medicare as an 80% payer, and you get a standalone or a supplement plan, a Medigap, those are interchangeable terms. Medigap equals Medicare supplement. And then you also get a standalone drug plan. So this is one route, one option you can go once you are eligible for Medicare. You have original Medicare as your primary payer, paying 80%. You have your supplement as your secondary payer, paying the 20% in the gaps. and then you have a drug policy to pick up your pharmacy cost. If you go this route, we'll look at the next slide. I'll show you kind of pros and cons to going this route and how it works. The alternative option is to go with a Medicare Advantage plan, also known as Part C. If you go this route, you are still paying the $144.60 to Medicare. And when you enroll in a Medicare Advantage plan, you're now getting managed by your Part C plan. Your Part C Medicare Advantage plan takes over Medicare's responsibility. So it gets a little confusing. You pay Medicare, you enroll in a Medicare Advantage plan, now Medicare Advantage is managing your care. It's the primary payer, not Medicare. So we'll talk about the pros and cons to going that route here in a second as well. But just want to clarify, you have two options, more or less. Option 1, supplement and a drug plan. Option 2, you go straight into Medicare Advantage. Chip.
Once you make that choice, is it irrevocable?
You're beating me to the punch.
Could these require us to switch doctors just in case? Or,
Yep. So we'll kind of get into all of that. But great questions. So let's look at option 1, the supplement and drug plan option, where you keep original Medicare as your primary payer, and then you pick up a separate supplement or secondary payer, also known as Medigap. It fills the Medicare gaps. And then a standalone drug plan. So everybody who goes this route will pay the $144.60 for 80% coverage. Then you'll pick up a private supplement policy. These are going to range between, here in Virginia, about $100 to $140 a month, depending on your plan and carrier. All of these plans have a letter, which gets confusing. It's an alphabet soup. You have plans A through N, the most popular being N, G, and F. And again, I don't want to get too in the weeds, but those supplement plans will come in, depending on which letter plan you pick, and pay your Part B deductible each and every year. It'll pick up your Part A deductible every 60 days, and it'll cover the full 20%. So a Plan F, which you probably read about in the past, will cover all gaps in Medicare. So when you have original Medicare and a Plan F supplement, you have 100% medical and hospital coverage.
So if you're retired from the federal government and you have a plan under federal employees health benefit, if you kept that, would that effectively be your supplement plus Part D?
Correct.
Okay.
Yeah. So if you're federal or TRICARE, you don't need a supplement or a drug plan or a Medicare Advantage plan, because in essence, your federal policy is more or less like a Medicare Advantage plan. HMO, PPO, you abide by those rules, and if you don't, you can always divert back to or fall back on Medicare. So this is for individuals who are not on the federal or GIHA.
So what is the coverage under the prescription medical? Is it 100%, or do you have it out of pocket? Or?
Nope. So 100%. Oop. Help. Okay. Great question. So 100% coverage on medical and hospital with your supplement and original Medicare, these two policies here. The standalone drug plan will cover your pharmacy benefit. You'll have co-pays for more or less all prescriptions. If you have a Tier 1, Tier 2 generic, or Tier 3, 4, 5 brand name, you're paying a structured co-pay every time you refill that prescription. This is where there's about 26 to 30 drug plan options here in the state of Virginia. So every year, let's say you choose a Humana plan for year 1, and then 2 years later you are prescribed different medications. We're doing free reviews for all of our clients every October through December. It's like tax season. And so we ask for updated prescriptions from our clients every year and make sure you're always in the right fit.
What organizations are providing the supplements? Those two boxes that you're showing.
Right here? Yep. So almost all major carriers are offering supplemental and drugs. So your Big Blues, yeah, your Anthem, your United Healthcare, Cigna, Care First, Humana, Aetna. You have a lot of carrier options in both supplement and standalone drug. And what's unique, being independent and being able to write with all of these major carriers, is you'll likely have a supplement with your spouse under the same carrier, but you could have a totally different drug plan with a different carrier from your supplement and from your wife. So your spouse could have a Humana drug plan and you could have an Aetna drug plan because you're on different prescriptions. These prescription plans are unique because they have negotiated rates with each pharmacy, or each pharmacy and drug manufacturer. So simvastatin under Humana could be wildly different than simvastatin copay under Cigna. So we review all of this for you.
So now let's say that you're on one of these plans and your drug is very expensive, but in this particular plan, so you switch. Do they have to take you?
Yes. So for the drug plan world, there's no pre-existing issues being considered, no looking at your health record. Every year during open enrollment, or annual enrollment is October 15th through December 7th. Every year you can rate shop and get into a new plan that will start January 1st. No health questions, no denial, you're automatically guaranteed. So we routinely save our clients between about $600 and $1,000 in both premium and copays just by simply doing a 10-minute review with a client. Usually it's over email or over the phone. I advise making a move because it'll save you X amount in your copays.
Does that cover drugs that are brand new to the market for tier 4 and 5?
Good question. Some drug companies will. If Medicare's not touching it, the drug plans likely aren't covering it.
Touching it.
They're not considering it a brand name drug. If it's too experimental, it's too new.
No. If it's FDA approved.
Typically Medicare or the drug plan will cover it. It really depends. You'd have to send me the medication and I can look it up for you.
Now, you might know this and have it in your presentation. Some drugs are so ungodly expensive that if some of the people have a lower income, they can go to a charity conglomerate that will help them pay the difference. Because this is not a CVS Walmart.
Right.
This is something that comes right from the drug company to you.
Yep. So there are options for pharmacy benefit programs where the pharmacy or the manufacturing company will offer a very heavy discount for somebody in that situation.
But that's not a CVS deal.
No, that's
Something that
completely.
really has to come from the hospital or the doctor in understanding your
Correct.
predicament.
Yeah, they're advocating.
That's only for lower income people because they do check income when they're giving the over coverage for that gap.
That's correct. And we'll touch base on the donut hole towards the end of the presentation. And that's where your pricing can skyrocket.
So under option 1, if your health history is not very good, do they deny?
So that's a great question. So when you have a special enrollment or an initial enrollment period, which is when you turn 65 and you are automatically guaranteed acceptance into Medicare, your initial or special enrollment period has a 6-month window to enroll in a supplement without health questions. So let's say you get Medicare, you retire, you do nothing for a year or two. You don't pick up the phone and call a health insurance agency to enroll in a supplement plan. You don't call me, we don't do anything. And then 2 years later, you are now looking at, knee replacement and you need supplemental. Now these companies can deny you or increase your premium based on your health history and pending health history. So it's really important when you create an initial enrollment period or special enrollment period, it's important to look at your options as soon as possible because you do not want to get locked out based on your health. This is the only market out there in health insurance that can still withhold pre-existing issues and deny you based on your health history.
So say you turn 65 on August the 1st and you sign up for your supplemental plan on August the 2nd and you're swimming along, and 2 years later, say you're in an HMO plan and you move to Iowa City and there's none of those HMO folks around and you need to get a new supplemental plan. Can they test you for holy?
So let's go back. So this is a really important, this is what I sit down with clients and inform you on, is your decision to go into a Medicare Advantage, HMO, or PPO versus going into original Medicare with a supplement and drug plan can have long-term consequences. If you go into a if you go into a Medicare Advantage plan, and then 3 or 4 years later you move and the new state, the new county, the new zip code you're in has only 1 or 2 HMO options with very limited networks, and you are not happy, and now you want to enroll in a supplement because you want nationwide coverage, now these supplements are going to ask health questions and they can deny you, and you are more or less locked into that HMO or PPO. You can always bounce around in the Medicare Advantage market. You can rate shop the HMOs and PPOs and go PPO to HMO and vice versa without health questions. But as soon as you want to go from Medicare Advantage into Medicare Supplement, that's where you have to be really healthy. Like, I get clients who are denied supplemental coverage because they're prescribed tramadol, a non-narcotic medication. And that's just a pain medication. And these companies will deny you. So it's really smart to think long and hard. Don't just look at the numbers over here, the cheap, low premium and the extra benefits. Look at the whole picture because it can have some pretty heavy consequences.
How about, you said in option 2 you can bounce around to different companies. Can you do the same thing in option 1?
Depends on the state. So born and raised Missouri. In Missouri, we have a unique law that allows you to go Plan G to Plan G or Plan F to Plan F with different carriers. Here in Virginia, Maryland, and DC, and almost all other states, once you pick a supplement, you are more or less locked into that supplement. It'll follow you nationwide. So if you're moving state to state, not an issue, it'll follow you. But let's say you want to go from Supplement Insurance Carrier 1 Plan F to Supplement Insurance Plan Carrier Plan 2 Plan F. They're asking health questions to make that move. So if you're trying to rate shop your Plan G or your Plan F within different carriers, they're asking health questions. So again, your decision here is also very important.
So you move to Pocatello, Idaho, and there's a HMO that you sign up for, you're happy as a clam, and it shuts down because rural communities are having trouble with keeping PPOs and HMOs. Are you?
You'd likely have an initial enrollment period or some type of special enrollment period. But if there's an option nearby you, the government's going to force you to stay in that specific scenario.
When you say the government, are you talking
Medicare.
federal?
Medicare. Federal. Medicare. All of these plans are state specific. These supplement plans, your initial premiums are based on the state of your enrollment, but they follow you nationwide. Yep.
I thought I just read can that go away in some states?
So probably a lot of you have read Plan F is going away. I'll explain it. So anyone who enrolled in Medicare prior to the year 2020. So if you picked up the premium Part A or Part B, then you are able to shop around Plan F indefinitely. It's not closing, it's not going away. So you're grandfathered into Plan F, accessing Plan F supplement. And again, Plan F covers all the gaps in Medicare. If you're turning 65 from January of this year and beyond, you cannot enroll in a Plan F. It's closed for any new Medicare beneficiary because it's too good. It's the Cadillac coverage. And in 2015, Congress passed a bill that said no Cadillac plans can be offered in the year 2020 and beyond. So to sidestep that regulation, these supplement plans came out with Plan G. Plan G is identical to Plan F in that it covers all of the gaps in Medicare, except for the Part B annual deductible, which is roughly $200. So Plan F and Plan G are identical except for a deductible of $200. So that puts some of your skin in the game. It sidesteps the Cadillac 100% coverage regulation. Plan G and Plan F are about $20 difference in premiums. So when you do the math, it's more or less the same cost for you or out of pocket. Plan N is pretty close to the Plan G. It's one step down in benefits. Whenever we sit down to go over a review, we're looking at whether you're allowed to get Plan F. We'll look at Plan F, Plan G, Plan N, along with the Medicare Advantage plans if you'd like to review those.
How would this work in some of that other countries?
Again, it depends on if you, well, are they working out of the country or are they traveling out of the country?
Well, I have both, because I have clients who do live out of the country, and I do have clients who will travel out of the country.
Yeah, it really depends on if they are paying Medicare taxes. Are they triggering the Part A and Part B qualification? If they're traveling out of the country, these supplements will give you roughly $50,000 of foreign care travel exposure. But aside from that, Medicare's not touching you. It's your supplement offering the foreign care travel benefit. Medicare only covers for in-state or nationwide coverage. So if you go this route, you're looking, let's just say you choose a Plan G, kind of middle of the road, and you choose like a $15 or $30 drug plan that covers all of your generics and a handful of brand name prescriptions. You're looking at about $300 for this total package. 3 moving parts: Medicare 80%, supplement covering 20%, and your drug plan covering prescriptions. $300 for more or less 100% coverage on your medical and hospital, and then copays on your prescriptions. It's great coverage. It's nationwide. If you have children out of state or grandchildren, or if you have second or third homes, again, those supplement policies are nationwide. You can go see any doctor so long as that doctor accepts Medicare. It doesn't matter with a Plan G if that doctor is assigned or non-assigned with Medicare. So long as they have some contract with Medicare, your supplement, specifically the Plan G, will cover your bills. All right? So very flexible and mobile coverage.
As you age and you need, let's say somebody goes in at 65, they hit 70, and they start needing specific medications that are more expensive, but let's say they don't get the Part D at 65, can they get it later?
So I always recommend getting, let's say you're not on prescriptions at 65 or when you are first Medicare eligible, and you say, you know what, I don't want to pay $15, I don't want to pay $30, I'll wing it. I always recommend getting the cheapest drug plan available each year because you'll avoid penalties and gaps in coverage. So let's say you say, I'm going to wing it, I'll be risky, I'll forego a $14 a month premium plan, and 3 years later, you come back and you say, I'm prescribed a $400 Restasis eye drop. I don't want to pay $400. What are my options? Now you have to wait until the annual enrollment period, which is October through December, to enroll in a drug plan. That drug plan won't start until January 1st. So you can have a pretty large gap in drug coverage if you forego a drug plan. And you're getting hit with a penalty each month that you go without drug coverage. So if you went 3 years, that's 3 times 12, 36 months of penalty that you've accumulated. So it's pretty significant. So let's say you have a $15 accumulated drug plan penalty. That gets tacked on to your $14 a month premium each and every month for the rest of your life, or as long as you hold the new drug plan.
Oh, it's not just for the 36 months.
Nope. So they'll use the term So let's say you went 3 years, 65 to 68 without Part D coverage. The government said you went 36 months without drug coverage. You now have a 36-month penalty period, and let's just say it's a $15 penalty that it's accumulated to. Now the government is going to add that $15 per month penalty to your already $14 a month Part D premium. So you pay your accumulated penalty each and every month alongside your new plan's premium. So if you wait until you're 70 or 80 to get a drug plan and now you want to get a drug plan, you're looking at like a $70 per month penalty on top of your new drug plan premium. So this is why I always advise, like, I think it's Humana and WellCare are two of the cheapest plans for 2020, $13. Just get it, set it, and forget it, because you never know when you're going to get prescribed a very expensive medication. There are ways. GoodRx is a free service online. You can punch in your prescription if you don't have insurance, or even if you do have insurance, sometimes it's cheaper. But you just want to avoid those penalties, and with pretty low cost drug plans out there, it's a no-brainer.
Now, if I'm on, how many different Part D underwriting companies are there? Approximately.
I would say between 25 and 30 each year.
So if I get in the cheapest one now and I get sick later on, can I change to the better ones?
Yep. So no health questions each and every year when you're reviewing. So if you're healthy.
Without the government penalty. I'm just going to say something. Anybody that doesn't buy exactly what you have on this page now is stupid. No. Beyond stupid. This covers you so well.
It's,
And
yeah.
I'm telling you from severe experience, because this Part D can cover tier 4 and 5 medications that are more expensive than the home you live in.
Yep.
And
Yep.
I'm not exaggerating in the least.
I see it every year.
So
It's,
this, you could do the whole seminar with this page alone and throw everything else away.
that's why I have like 3 renditions of this page. I think I told Susie, I was like, this is the bulk of the conversation right here. So positive to going this route: flexibility, mobility, nationwide coverage, headache-free, no networks that you're dealing with. You're not going to lose your doctor. Again, as long as your doctor takes Medicare, which don't listen to the noise out there. It's like 97% of doctors nationwide are taking Medicare. All of your big cancer hospitals are taking Medicare, regardless of assignment or non-assignment. Your concierge docs, VIPMD, they all bill Medicare. The doctors that don't take Medicare are the ones that you're paying $10,000 for a joint surgery. Those, you're going to question whether or not you want to stay with them. Yes.
So I just make sure I understand this correctly. Part B, if I'm under a federal government,
Okay.
I take Part D there. If that should ever go away and I have to go under Medicare, there's no penalty, right?
For the Part D, correct, because you're holding credible coverage. So that's another important facet of employer. So let's say you're working after 65 and you have large group coverage. You always want to ask your HR coordinator if it's credible drug coverage. They'll generate a letter, they'll mail it to you, and it'll state this: your coverage from X date to X date is credible coverage, deemed credible coverage under Medicare, which more or less means it's as good as Part D. So once you get that letter, hold on to it, and then when you're ready to make the move into Medicare with a supplement or a drug plan, or if you're going from federal and you just want to pick up some additional drug coverage, you can opt into these drug plans without any issue. All right, so that's just one option. The alternative is the Part C. Here in Virginia, you have premiums that range between about $0 to $130. Most are falling between about $0 to $50 in monthly premium. So no matter which option you choose, option 1 versus option 2, you're always paying the standard Part B premium regardless of your choice. When you enroll in a Medicare Advantage plan, you also pay a monthly premium, whether it's $0 or $15, to your HMO or PPO plan. Now that HMO and PPO plan is managing your care. So with option 1, with the supplement, you had original Medicare managing your care, which meant you could go nationwide to any doctor that took Medicare. With this option, you're confined to your HMO's network. So they're giving you a really low monthly premium, but they're offsetting it with restrictions. You have to stay in network with an HMO. If you're out of network, you're paying 100% of out-of-network non-emergency care. So if you want cancer treatment in Boston, you're out of network with an HMO. With a PPO, you're paying about 30% out-of-network charges. These HMO and PPOs, again, low monthly premium, very attractive, but if and when you start using care, you're responsible for coinsurance and copayments up to anywhere between $4,000 and $10,000 per year. That resets January 1st. So if you have a $50 HMO, yes, that looks attractive, but what is the underbelly looking like? What's underneath the hood? You have a $10,000 out-of-pocket exposure.
If you have this Medicare Advantage and you call a doctor for service, the question is important when it's a specialist, because that's where the 3% are. You don't take it, and you say you're a Medicare patient, Medicare covered. Do the doctors want to know whether you're in the Medicare Advantage?
100%. You wouldn't say I have Medicare because Medicare is no longer your primary payer. You would say I have Medicare Advantage, United Healthcare HMO, or CareFirst PPO, or Kaiser HMO. That's what your doctor wants to know. Whether you have original Medicare as primary and a supplement, they want to know that, or if you go in a Medicare Advantage plan, they want to know if you have an HMO or a PPO. Who's the insurance carrier? Are they in network? And then they're billing Medicare Advantage directly as opposed to going through Medicare and then funneling it into your supplement.
They're billing who directly?
If you have a Medicare Advantage plan, your doctor's office will send the bill to your HMO, not to Medicare.
What you said,
Are there any nationwide advantage plans like Blue Cross Blue Shield?
It's all county and region specific. So here you have 4 or 5 different carriers offering product. In Missouri, we have 5 or 6. It's a much more competitive market in the Midwest than on the coast for these Advantage plans.
when you said it was $4,000 to $10,000 a year, again, what was that?
That's your max out of pocket. So you have a low monthly premium. That's why these are very attractive. If you're healthy and you don't hit your max out of pocket of $4,000 to $10,000 a year, you're saving some money. Okay, these plans also typically include dental, vision, very basic benefits, nothing Cadillac on the dental and vision. They also throw in gym membership or hearing aid coverage. So these are the extra benefits that are very attractive for some individuals, but it's good to know what are the pros and cons over here. Yes, you're getting extra benefits, but at what cost? What restrictions? As long as you play by these rules of the HMO and PPO, you're in good shape. If you start traveling, you're out of network, you need cancer treatment, you need specialists that are out of the network, now you're not playing by their rules. They can't contain or manage your cost. They're hemorrhaging money if they were to cover that, so they don't cover it. You get a lot of prior authorizations. I don't want to sell you out of one way or the other, but I like to educate my clients so that they're making an informed decision. Again, I'm licensed and appointed with all of these carriers. It just boils down to what's good for my client.
And so if you go on holiday to France for a month and you break your leg, you don't have any coverage, right?
You actually do. So when I referenced non-emergency care out of network is not covered by HMOs. It's covered at 70% by PPOs. But emergency care worldwide is covered by these. And over here you get 50% or $50,000 worth of worldwide or out of the nation coverage. So they do protect you for for emergency room situations and most urgent care situations.
Each year, can you choose to go one or the other, or are you going to get into that?
So let's say you opt for Medicare Advantage at 65 or at 67 when you retire, you jump into a HMO or a PPO plan. And then the next year, your doctor changes and you want to follow your doctor. You more or less need to shop around HMO and PPOs to see if your doctor's in network. But as long as you're staying in that Medicare Advantage world or market, you can rate shop and bounce around PPO to HMO very easily without health questions. Where you get hung up is if you try to go Medicare Advantage into a Medicare supplement. That's where you start seeing health questions with all carriers. There is an exception. If you, let's say at 65, you get sold an HMO and 6 or 9 months later you're like, oh my gosh, I made a mistake. You do have a 1-year trial period where the government, federal government, will let you go from HMO or PPO, Medicare Advantage plan, into a supplement without health questions within that first year of enrollment. After that, now you're looking at staying in an HMO and PPO for life unless you can medically underwrite into a supplement.
Did you say that generally option 2 would be for more healthy people? Or is that?
It depends on where my clients are, but I would say roughly here it's like 80% go supplement, 20% go HMO. In Missouri and Midwest, Kansas, Illinois, it's more 50-50. So where I see clients attracted to a Medicare Advantage plan is if, yes, they're healthy and they haven't had family history of going through this nightmare. They don't have any experience. They don't know what the headache, what kind of a headache prior authorizations can be. Here, as long as Medicare approves your service, which is 9 times out of 10 they're going to approve because if it's medically necessary, they're prone to approving it, then your supplement, no questions asked, will cover the bill. So long as Medicare's triggered, then supplement pays.
But they will sometimes say, you know, you're not going to cover this.
Yeah, I've seen it. That's 9 times out of 10. Medicare is pretty lenient on what they cover. It's very specific. Whereas over here, yes, you'll get coverage, hopefully, but there can be prior authorizations that take some time.
So for whatever reason, we were in option 2, and we needed to go over to option 1 or wanted to go, and we had to do all of the work you're saying. Do you help us do that?
Yep. Yep. We'll answer health questions. We'll follow it through the whole process of each insurance company.
You had mentioned benefits over here, vision, dental. Are any of those in the straight Medicare?
Some of the supplements offer the Silver Sneakers or Renew Fitness. It's a free gym membership. But aside from that, you're getting a standalone dental, vision, hearing aid plan. A lot of people will self-insure that risk over here, or they'll just get a dental plan for anywhere between like $20 and $40 a month.
Are the, for some of the more expensive procedures, do the better supplement companies cover the difference anyway, or do you still have to go in and get a okay prior to?
As long as Medicare is covering the procedure as primary, so this route they would cover it as primary, it does not matter which carrier you have. They are all mandated by federal law to pay once Medicare is triggered. There's no maximum payment or lifetime maximum over here. If you have $10 million worth of medical claims over a 15 or 20-year period, these supplements can't kick you out. They're what's called guaranteed issue, guaranteed for life. Let's say you choose a very small carrier supplement and they go underwater and now you're left without a carrier. There's state and federal protections that allow you to move into a like or similar plan without health questions. But again, if you're rate shopping a supplement from one carrier to the next within this market, you have to answer health questions. So if you're healthy, you can go any route whenever. But if you're unhealthy, you more or less are locked into your supplement carrier or your Advantage plan. It's very easy to go from a supplement into an Advantage plan down the road. These guys will take you whenever, wherever. But the opposite is not true.
But you gotta have a really good crystal ball.
Yeah, yeah. So roughly $300 in premium this route. Over here, you're looking, let's just call it $144.60 if you go with a zero premium HMO. These plans also include Part D prescription drug coverage in addition to the rest of the extra
And
benefits.
those rates are per person,
Correct.
and there's no discount for both spouses.
Some supplements will offer a discount. It's like 5 to 10% off your monthly premium. Depends on the carrier.
How is a private insurance carrier being compensated if the premium is zero?
It's a great question. So you pay Original Medicare, but you don't have Original Medicare's primary payer when you go into an HMO. How does that work? Medicare, you pay Medicare. Medicare turns around and contracts with your HMO. And Medicare will pay the HMO each month that they are managing your care. So this is all happening in the background. So you no longer have Original Medicare as your primary payer. Your HMO's covering you, and they can cover you at a zero premium because they're getting paid about $1,000 a month from Medicare. Medicare, just kind of a little history, Medicare on average pays about $1,200 a month for each Medicare beneficiary. That's the average cost. So if Medicare, when you get in a Medicare Advantage plan, if Medicare can outsource their responsibility for $1,000, and if you stayed this option, it would cost them $1,200, they're making money. So Medicare actually likes the government likes when you go in Medicare Advantage because you're no longer their responsibility in the eyes of payment.
Let's say, just take option G, and option 1. What's more important, the name, like an Anthem or Care First or whatever, or the price? What would you typically look at as more important?
I would say the important factor to look at is the stability of your supplement. So with larger carriers, you're going to have a longer, less volatile rate. You have more rate stability with larger carriers. With smaller carriers, you can see pretty hefty spikes year to year in your premiums. So a lot of carriers, and again, I write with them, all of them, but a lot of the smaller carriers will entice you with a very low premium. And then 5 years, 2 years, 3 years, 4 years, 5 years into your plan, they're going to cherry pick a 67-year-old or a 70-year-old and say, we're raising you by 10 or 15%. Where a lot of these larger carriers have more risk pool, more market share, they're much more stable.
Do you keep historical information where we could see, let's say, for the last 5 years, that increased, 10%?
It depends on the carrier. Not all carriers provide that, but I do have a handful of carriers that offer that information. Again, it depends, and it's all, Medicare's federal. Your supplement is abiding by federal regulations, but all of their rates, like Anthem here versus Anthem in California versus Anthem in Missouri, all different. All different rates, all different increases. Counties can have different premiums. So any other questions on this as a nutshell? This is the bulk of Medicare.
So what happens if you sign up for a supplement plan and the company you signed up with merges, goes out of business? Do you have to then re-qualify for medical, or do you get an exception?
You get an exception. So you have a special enrollment period if your company disappears or merges. You have a special enrollment period to get into a like or similar plan without health questions. Good question. Okay. So when do you start this process? And I know, Tom, you had some questions on this. So 6 months out, generally from your desired Medicare effective date. So if you're turning 65 in June, I would start this conversation this month. Okay? You can actually enroll in Medicare 3 months out from your birthday, but I typically say start the ball rolling, get the ball rolling about 6 months out, so we know exactly what to expect moving forward. Your Medicare initial enrollment sign-up period is 3 months before your birth month. So if your birthday is June 29th, like my own, then I can get Medicare into effect on June 1st, the first of your birth month. I can sign up 3 months out from my birth month. All right? If I'm late to the game and I make a mistake and I just ignore all the Medicare noise out there, I can also enroll 3 months after my birth month and still avoid any penalty. If you enroll after your birth month, do take into consideration that your Part B, that was the medical portion, your Part B will be delayed. So if I enroll 2 months after my birth month, my Part B won't start for another 3 or 4 months. So you can get some gaps in coverage if you're late to the game.
Do they notify, do they send you something in the mail?
Good question. So if you're on Social Security before the age of 65, Medicare will automatically be enforced. Medicare and Social Security are coordinating their conversation with one another. And if you're on Social Security before 65, you're automatically enrolled in Medicare Part A and Part B. If you are working with a large employer, then you might need to opt out of Medicare if you're automatically enrolled. It just depends.
Would you change your timeline if, let's say, I knew I was going to work till I was 70?
Yep.
But I didn't come 6 months out of time, and that's when I retired, I left the firm. Would you go back 6 months from 70 versus 65?
Correct.
Okay.
Yeah. So typically I'll get a client who wants to continue working. They're on a large employer plan. They'll either come in or just give me a call, and within 5 or 10 minutes of that conversation, I know whether or not they need to take Medicare. If they're delaying, then yes, 6 months out from the retirement date or as soon as they find out they're losing coverage, whichever comes first. Once you're in Medicare, you can review your drug plan each year without health questions, your Part D plan, during the annual enrollment period. That's October 15th through December 7th. No health questions. You can also rate shop your Medicare Advantage plan, that was option 2, without health questions if you're going HMO to HMO or PPO to PPO, or HMO to PPO. Again, the Medicare supplement plans, you can rate shop any time throughout the year, but you're subject to that medical underwriting. Let me take a step back. When you turn 65 or you qualify for your special enrollment period, you're retiring after 65 from a large employer, no underwriting because you're within that 6 month or 8 month, it depends on your situation, window of enrollment. So no health questions to get into the supplement plan at your initial or special enrollment period. So, like I said at the beginning of the seminar, October, November, December is like tax season for us. It's crazy. All of our clients get an annual review form emailed and mailed to them asking for updated prescriptions, updated addresses, updated doctors, anything significant that's happened we want to know so that we can always assess and make sure you're in the right plan moving forward.
What percent of your clients change plans?
Good question. I would say about 25 to 30% change their drug plan year to year. Not the same client every year. It just depends on change of prescriptions, but I would say it averages about 25 to 30%. And that's within $600 to $1,000 of savings. Usually, if a client is saving $400 or more, that tips the scale to make a move. Some clients don't want to make a move because it's just a headache to change drug plans. You may need a change of pharmacy. You got to reorder your prescriptions. So I kind of feel it out with clients. So last part of the seminar, hopefully you guys are all taking some good notes and learning some things. But last part is, what are some recent regulatory changes that have an effect on your enrollment and the pricing? So IRMA, we discussed that your Part B standard premium is $144.60 per month. That's standard for everybody. if your income, and sorry, this is a little blurry here, but if your income, Medicare uses your modified adjusted gross income from 2 years back to set your current year's Part B premiums. So let me give you an example. If you're turning 65 in 2020, let's just say June of 2020, Medicare is using your 2018 adjusted gross income information to set your 2020 Part B premium. So if your income falls under $87,000 as a single tax filer, your modified adjusted gross income for 2018 is under $87,000 or $174,000, you're paying the standard Part B premium, $144.
What if your status changes from married joint to individual in that time?
Good question. We can appeal these figures, and I'll talk about that in a second, but there is room for appeal, which I handle with clients. So let's say you and your spouse are making between $174,000 and $218,000 pretty routinely year to year. Medicare is going to tack on an extra $70 in IRMA surcharge. So on top of the $144.60 and your Part D premium of, let's just say, $13, you're paying an additional $70 because you're considered a high-earning individual. This is all tiered. So instead of $144 per month, you're paying, close to $200 a month. If your spouse, you and your spouse are making between $326,000 and $750,000 a year, you're looking at a pretty hefty price for your Medicare. Your monthly surcharge is going to be closer to $400 plus your standard Part B premium of $144. So all in, you're closer to $500 for just Part B premiums alone.
Per person.
Per person.
Spouse pay the same.
So this is where when you have plans to continue working after 65, and let's say you're making, $500,000-$600,000 a year, and you're going to keep working and you have that large employer, 20 or more employees, this is where we sit down and we say, okay, I'm paying $1,000 for my own coverage and my spouse's coverage under my group employer, has a $2,000 deductible. If I go into Medicare, I'm going to pay $500 a person with IRMA, the surcharge, because my income's high, plus I need my supplement, plus I need my drug plan. That puts me at about $1,200 a month in premium. Medicare doesn't look so attractive now. Now, there are ways to appeal this surcharge. So let's say you're working after 65 or you're retiring at 65 and you want to take Medicare. If you've had a reduction of work hours and you've recently retired and your income drops, you go from making $500,000 to $200,000 or $100,000. Now we can request a reconsideration and be successful with our appeal. We can say, hey, Medicare, use my 2020 expected adjusted gross income, which might be $100,000 or $200,000. Don't use my 2018 adjusted gross income because I've had a recent retirement. And you're 10 times out of 10, you're successful with that. If you have a divorce or you get married and your income fluctuates and Medicare has no idea and it takes you out of one income bracket into the next or drops you in income brackets, you always want to update Medicare because you can save quite a bit of money in monthly premiums and surcharges.
So are you saying that if you went into Medicare in a very high earning year, you're saying they could base it on that for the future, or don't they adjust
They will.
it as you file your taxes?
They adjust it. So
Okay,
each year,
automatically, each year, I could go into a smaller income year and they'll adjust it automatically.
correct. So Medicare is always looking 2 years back. So for 2021, they're going to use your 2019 income. So if you're going into Medicare this year with a very high income, say you're making, $600,000 this year, and the last 2 years you only made $200,000, Medicare hasn't caught up yet. So in 2022, Medicare is going to use your 2020 adjusted gross income, which is high, and they'll reset your premium with the new surcharge. So it's always updated January 1st based on your tax return information from 2 years prior.
So if you work to 65, you know, and you retire, you're not gonna, assuming that you're earning less in retirement than you did when you were working full time, you're not gonna feel the effect of the reduced Medicare cost until you're 67.
Correct, but we can appeal it. So you update Medicare with your current life change. You've had a life-changing event, you can update Medicare. They'll drop it down to your new expected adjusted gross income.
So recently stopped.
Mm-hmm, mm-hmm.
About the timing of these appeals, I know this is kind of confusing.
Yeah, yeah.
But let's say you know that you're gonna have a disastrous tax year of, you know, 2019. When would be the time that you would appeal, let's say, 2020?
So Medicare typically sends out an IRMA determination letter in November, December of the for the upcoming year. Once you receive that letter, that's when you submit an appeal form.
Why did they mention modified adjusted gross income instead of just adjusted gross income?
Yeah, I believe, what was it, 2 years ago or a year ago, they took the modified adjusted gross income off the tax forms. I'm not sure if it's still on there. In years past, it was modified adjusted gross income, but I believe tax.
No, it still says
It's-
adjusted. It has said adjusted, but I think there's certain things on the adjusted gross income you're going to change for, like.
Yeah,
Social Security benefits.
they're using your modified adjusted gross income. Most clients don't know that off the top of their head. So if you can give me your expected adjusted gross income, we're going to narrow it down to a pretty close figure. That's why I like to work with accountants and financial advisors, because we can tweak these numbers depending on client specifics.
Should you set up for electronic payment? What's your experience?
It's funny you ask. I had a client call me yesterday about it. She set up Easy Pay, where they will draft your IRMA and monthly Part B premiums directly out of your bank account, and Medicare is still billing her each month or each quarter for her Part B premiums and IRMA. So she has no idea if she's double paying. Unfortunately, I can't log into Medicare's billing. That's usually when I say call 1-800-Medicare. You'll get somebody on the phone pretty quickly. It's not like Social Security's website or phone hotline. 1-800-Medicare is a little more prompt, and they can see what's going on. Most people like the Easy Pay. Others like to just pay quarterly. If you opt for direct billing, Medicare is going to bill you each quarter. I will say the government never gets it right. A lot of clients will get like 3 different bills showing the Part B standard premium that they owe, and then 2 or 3 or 4 weeks later, they'll get another bill saying you owe X amount for IRMA. Oops, we didn't calculate it right. Here's another random bill for $60 that you owe as well. So it can be very confusing. Clients, they'll send me pictures, and the bill will say this is not a bill, and they think it's a bill. So if you ever have questions, just shoot me an email or a phone call, and I can walk you through it. But Medicare is, yep, that's fine. So Medicare is never on the ball with their billing.
Would it be fair, I agree, yeah, with the billing, but once you start Social Security benefits, then they just deduct it, the experience is that they get it correct.
That's correct. It's a little more streamlined once you're set up on Social Security deductions. Yeah. But prior to that, when you're not on Social Security and they're billing you automatically or directly, it can be a little bit wonky. Hope for the best, plan for the worst. With the supplemental, I don't know what to tell you. I'm just giving you horror stories instead. It depends on what you're comfortable with. A lot of clients don't want to give out their bank account information. They've had experience getting hacked or whatever the situation may be. Other clients like the Easy Pay. With the supplemental drug plans and the HMOs, I can access that. So if there's ever an issue or a question, usually I can handle that for you as a middlewoman. Last but not least, donut hole. How many people have heard about the donut hole? Okay, how many people have heard the donut holes going away or getting closed? Okay. So in a nutshell, again, I don't want to go too far in the weeds, but hang in there with me. In a nutshell, with prescription drug coverage, whether you go option 2, HMO, PPO, or you go option 1 with Medicare supplement and a drug plan, your drug plan will have really 3 stages of coverage. So let's say you get your drug plan in effect for January 1st. You're in stage 1, and you have a medication that costs $1,000 a month. In stage 1, you're paying a simple copay. You have a structure set up within your drug plan. So if it's a tier 1, tier 2, generic, you're paying a copay in that stage 1. If it's a brand name, you have a set copay for tier 3, 4, 5 brand name or specialty drugs. Once you're out of pocket, what you pay in your drug plan pays, so your total cost of the medication, once that meets roughly $4,000 for the year, you're now taken out of stage 1 simple copay structure payment, and you're put into stage 2 donut hole, also known as the coverage gap. Once in stage 2 donut hole, Medicare and your drug plan back away and put more of the cost responsibility on you. So once you hit $4,000 in total out-of-pocket and retail cost, you're now in stage 2 donut hole, and you're paying 25% of the cost of a brand name medication, as opposed to a simple copay of $40. So this is where clients who are on expensive medications, either one medication that costs $1,000 or $10,000, or a handful of medications that cost $4,000. This is where it can get very expensive in Medicare. And this is where the federal plans are beneficial because they do not have this donut hole. Just throwing that one out there. So regardless of the option 1 or option 2, you're going to have this exposure. So the government has declared that they've closed the donut hole because they have capped your brand name copay exposure once in the donut hole at 25%. In years past, your exposure once you hit that donut hole was upwards of 60 to 70% exposure. So in years past, clients were going broke trying to pay for these expensive medications. The government came in and said, okay, we're closing the donut hole as of the year 2020 and beyond. Nobody's paying more than 25% of the cost of their brand name medication or generic medication while in the donut hole. You don't stay in the donut hole for the rest of the year. Typically, when your true out-of-pocket cost, what you're paying, there's a few discounts involved in there, your deductibles. When your true out-of-pocket cost meets roughly $6,300, now you're taken out of the second stage donut hole where you're paying 25%, and you're forced into what's called stage 3 catastrophic coverage. Now Medicare and your drug plan comes back, says we're here, we'll pay 95%, you pay 5% of your medications for the remainder of the year. So if you're on a specialty brand name medication that's brand new and it's on Medicare, you're in and out of these 3 stages within 1 or 2 months. So you go straight into paying 5% for the remainder of the year, but you have pretty significant costs for that first month or 2. So if you're on expensive medications, this is where, again, we're sitting down each year and we're looking at what are your true costs, what do I need to expect for the first few months of the year and after that, so that I can plan and calculate my exposure for the year. Again, a ton of volatility in these markets. One plan can have your brand name prescription listed on its formulary. Another drug plan will drop it. And that happens year to year without even a heads up to the Medicare beneficiary. So I always, if you're on Medicare now, review, review, review. Once you get on Medicare, there is no setting it and forgetting it. You'll get burned.
So do I have it right that if you're currently on Medicare Advantage and you decide you want to go to your option 1 supplemental, your vulnerabilities are you may have to answer health questions and there'll be a lead time? Are there other vulnerabilities
Really, there's no gap in, is that what you're saying, gap in coverage? If you're going Medicare Advantage and you're approved with a supplement, we'll time it so there is no gap in coverage. Really, that's your exposure. If you're trying to go from Advantage plan into supplement, your exposure is getting denied or an increased premium based on your health risk.
Can I give you a little plug?
Yeah.
I'll say it again. I had an 85-year-old doctor, very highly accomplished 85-year-old doctor, the best advice I ever had in my life. If you get on Medicare, have a good, not a Hyundai supplement, but a good Lexus supplement with the good Lexus RX. Close your eyes, don't worry about it. There's also something you haven't said either. The HMOs are a joke. All this crap to the right is a joke because you could be denied. With a good plan, option number one, I could go to Rolls-Royce hospitals and get Rolls-Royce doctors and surgeons. 10 times better than Inova. Inova is coming way down for me. But when I go to a Rolls-Royce hospital, I drop that card, I drop that second card, I'm in the system, and it's cheap. Cheap. I got that advice from a great 85-year-old internist. It's probably the best advice I ever got in my life. And I don't even want to breathe in this room how much one of my medications is. And it's literally covered to the point where I sing a song to pay whatever they want.
Yep.
Over and above. Couldn't care less. But that number one, with a good supplement and a good RX, you can sleep at night. You don't have to worry about it. Nothing will they cover it. Do I have to go to a lesser grade, third world doctor for that? No. You can go to Rolls-Royce and you're covered. Not even worth talking about, not even worth thinking about. You're getting my 85-year-old internist advice. Did very well, but all that other stuff's good.
Again, it's client specific. So, but yes, this is Cadillac, Rolls-Royce, Lexus, whatever luxury car you want to compare it to. It's good coverage. I wish I had Medicare in this option because I'm paying an arm and a leg for a $5,000 deductible. I just met it with a baby. So, $5,000 deductible plus this is ACA healthcare reform. You had a question.
So, just a range. So, and I know that everyone's specific, but for Part A, Part B, Part D, and Part G,
A lot of letters, I know.
I mean, are we just a range for regular coverage and all those? Is it like $800 a month, or are we talking $1,300?
If let's say you're under those income brackets, $300 for the whole setup. Yep. $300. If you go the alternative route, you're looking at $144.60 with a zero premium HMO. Now, if you have high income, that's where you get the $70 surcharge, the $200, the $400. It depends on your income levels, and those can be adjusted year to year based on your modified adjusted gross income, and you can appeal that surcharge if you fall into a life qualifying event.
And that $300 a month covers all hospitalization, no copays or anything like that, all doctor visits, no copays, but there are copays for the drug.
Correct.
So that's the only variable.
Correct.
In that $300.
With a Plan F, you get 100% hospital and medical. Plan G, again, you have that $200 per year deductible. Kind of peanuts if you look at the grand scheme of medical costs.
Is that 300 plus 144.60?
Includes the 144.60. So all three moving parts total, roughly $300. Plus any of your income adjustment. Any other questions?
What is the reason for the penalties? I mean, to go forever? I mean, I could understand a year or something,
Yeah.
because it's just, has anybody ever tried to?
Call your congressman. It sounds a little bit harsh, but they want everybody to take Medicare. They want to have a large risk pool. They want people paying into Medicare. That's how insurance works. You have a risk pool. 80% are paying in, and 20% are the ones who are using and really needing the care, spending a lot of money. So.
So, and really, if your income just really, even after you retire, continues to go up because you have to take RMDs and that sort of thing out,
You're going to be
you're paying for
surcharged.
You're paying
Yeah.
for someone else.
Great tax plan with your CPA.
Yeah. Exactly.
So we promised to get you out of here at 11:15.
Oh my God.
Okay. And,
My presentation was 23 minutes without questions,
No,
just
it's
for
great.
the record.
Margo's gonna still be here if you want to hang
Yes.
around and ask her questions, because we'll be taking you to lunch, and then we have another presentation this afternoon. But what I hope you got out of here, remember when I started, I said it was what I thought I knew, that I then realized what I didn't know. So I hope that also happened, because this is great. So thank you so much.
Thank you, guys. And thanks for all the great questions.